At Eastern Virginia Medical School, we teach tomorrow's medical and healthcare professionals to become the leaders and healers of the future. Located in the heart of Norfolk's historic Ghent neighborhood, our campus sits on the largest medical complex in the coastal Virginia area. As resources for our community, these healthcare facilities provide excellent opportunities for our residents, with access to world-class doctors and a variety of unique pathologies. The EVMS Radiology Residency Program offers more than an opportunity for mentorship and experience. It is your chance to train with the best in their disciplines. At EVMS, we're making the future of healthcare a reality today.
So when I was interviewing for radiology residencies, you'll notice that almost all of them are very similar because everyone's nice, everyone loves their job. So you really have to focus in on those differences.
The radiology residency program serves about 16 people. There's 4 residents a year.
So we are a smaller size program, but I think with that, there are a lot of advantages.
Being a small program, but in a large teaching hospital environment is rather ideal, I think, for resident training. So we have the large hospital size and teaching faculty and volume of patients and exams and procedures to offer tremendous resources for outstanding training for our residents.
We have a really good relationship, I think, between the residents and the faculty. You get to know each other really well. There's a lot of opportunity to get individualized teaching and a lot of attention during your training.
I think what makes EVMS and this residency shine is the no fellows. So if you're someone who learns by doing, this is the best place to come to.
Many teaching programs have lots of fellows. Fellows are higher than residents in the academic scale. They're formerly residents. So they outrank residents and they sort of get first dibs on whatever is going on in your teaching program. Here we don't have fellows competing with the residents, so the residents get first dibs.
We're the ones that are doing all the procedures, so there's a lot of direct patient care, which I guess radiology isn't really known for.
When you come in, you are starting right off the bat. You're expected to get your feet wet right away.
The high number of procedures and focus on getting us geared for procedures early on in our training, like within the first 4 months. So we do get a lot of very early patient interaction.
Our primary campus is here at Sentara and Norfolk General Hospital. There is the primary hospital, and then there's also the Sentara Heart Hospital that's here. And then also in this same campus, well, the medical school is just across the street. And then also Children's Hospital of the King's Daughters is also here, which is a freestanding pediatric hospital.
Many residency training programs do not have a pediatric teaching hospital like we do. It's actually one of the relative weaknesses of a lot of teaching programs. Sentara Norfolk General Hospital as the main teaching hospital, Children's Hospital of the King's Daughters as the pediatric teaching hospital. They are the quaternary care teaching hospitals for the greater region of Hampton Roads. So that's something on the order of 1.7-ish million people we serve. You can go to a place like, say, New York City, and they have more people, but it's divided up over many more teaching hospitals. We are it. We are the quaternary care referral centers for Hampton Roads.
There's a wide variety of pathologies that we see in our practice. So you're going to get very comfortable seeing the complicated neuro cases, the complicated surgical cases, the traumas that come in, the oncology.
So we see a ton of trauma. We're level 1 trauma center. The residents get extensive trauma training on call. We do see the whole gamut of rural to urban populations. I think the biggest program strength is that they really come out very well trained and they really get to see everything. Even without a fellowship, they'll come out ready to go.
I've just recently finished this process, so there are a lot of different programs out there, but what it comes down to is your day-to-day life as a resident and the level of education that you're going to get, and there's no place that I could give a higher recommendation than here at EVMS.